With breast cancer, things have changed a lot since I went through training. At that point, in the mid to late 80s, majority of patients were still having mastectomies. They were diagnosed at a later stage that they'd all have to have lymph nodes removed and really have long-term outcome problems. And even then, survival was still about 70% long-term survival from breast cancer. Now, survival for breast cancer is over 85% long-term. And then we're able to do a lot less trauma to the patients. The cure rate is improved by two things. One is mammograms. We see many more patients now. There's no way they could feel these cancers. They're caught early, and the earlier they're caught, the more curable they are. And also, the earlier they're caught, the less invasive our treatment has to be. The second component that's helped cure on breast cancer is the chemotherapy. It is markedly better than it was 15 or 20 years ago. It's still harsh, still hard to go through, but they cure cancer so much better than they did before. So what we're able to do now is much less surgery. I hate to say that as a surgeon, but it works very well for patients. Instead of mastectomies, majority of time we're doing lumpectomies, 2 times out of 3. And most of that is patient-driven decisions. And lumpectomy patients are cured just as well as mastectomy patients. So we're not losing patients to the cancer because they're wanting less surgery. So it works very well. Typically, with a lumpectomy and radiation, their survival is just as good as a full mastectomy.